thank you for being here. We're going to be talking about something that I'm really passionate about, and I called it Soulful Sessions, where we're nurturing emotions with dental and biological discoveries. If you look at that image that I have there, I'm fascinated with it because there is a lot of information that we store in our bodies. Science and research have been showing a lot of connections between what's happening in our mouth, what's happening in our body, but then my passion, what's happening with our emotions. So I put the picture as if we are in a cave. We're going to go and dive deep into exploring what our teeth, our mouth, our body has to talk to us about, what we need to work on to be able to grow in our evolution of this life, this amazing journey that we're in. So we're going to talk a lot about emotions. We're going to experience some of those emotions, but most important is, what is that connect? Why is it a dentist talking about emotions? My goal is to explore, because I'm also exploring with my patients and with myself. What is that connection between the mouth, the body, and the mind? And then just uncover those emotional factors that are underlying the dental and then the health issues. And I want to give and provide practical strategies, techniques, tips to improve health and happiness. That's what I would like to achieve. So let's go now and start thinking about how this connection happens. What is happening with our mouth? What is happening with our bodies? What is happening with our emotions and how they are reflected in the body? There is a lot of research that is strongly supporting that connection between the oral health and the physical well-being. So according to Mayo Clinic, the gum disease, for example, if your gums are bleeding, but more importantly, if this gum disease got worse, it got more severe, which is called periodontitis, there is a high risk for patients that are having diabetes, that their diabetes is going to get worse. There is a high relationship between periodontitis, or that inflammation of the gums and the bone and around the teeth, with cardiovascular disease. Is connected also with Alzheimer's disease. It is connected also with mothers that are pregnant. There's usually a correlation between a delivery of the baby early, so preterm babies. It is important to know that when we have problems in our mouth, it's not only affecting our physical, just localized area, it's also connecting with the rest of the body. If you look at it, we can see here how the tooth, especially on this image, you see the tooth, and then we have the capillaries, we have the veins, we have the arteries that are going to that vasculatory system, the connection with the veins and the rest of the body, and then how they are connected with the rest of our organs. And if we start exploring even more, we're going to go and see how traditional Chinese medicine, for example, has a bigger connection with what it is that the teeth are connected to, which organs are they connected to. So we're going to see on a study that was done in the 50s by Dr. Reynold Boll and Dr. Kramer, where they started drilling on teeth, and they used a device that was connected to different organs, and they found how every single tooth is connected to a meridian. A meridian is like, imagine like a highway. And that's what acupuncturists use when they're, for example, treating your liver and they just put a needle on your hand. How is it possible? They're treating my liver that is not in my hand. So then they put that needle on that meridian pathway, on that highway that goes to the liver. Well, it is exactly the same as what happens in the teeth. They were actually referring to the teeth as being the first acupuncture needles, because the roots, if you look at it, the roots then they'll go and connect with these meridians. So if there is a problem on a tooth, there is a high possibility that that meridian is blocked. So you could be having some symptoms on your tooth, but then there is an imbalance, for example, on your liver, on your kidneys, or your gut. We can see that every single tooth, every single part of our body is connected. But then let's go a little bit deeper. And then let's just find that connection between the mind and the body. Well, there is a study that in 2019 that revealed that those that are suffering from a condition of clenching, grinding that is called bruxism, they also had elevated cortisol levels. Cortisol is the one that gets elevated when we're stressed, when we're under anxiety, for example. If we have a lot of stress, the cortisol levels will go up. And they found that when the patients are clenching or grinding, which is called bruxism, this hormone increases. This cortisol level increases, and that is a stress regulated hormone. So then it also reveals that investigation, that research, that there is a relationship from our nervous system with the bruxism. But the most interesting part of it is that they found that before the person was clenching or grinding, their heart rate was increasing. So there was an increase in the heart rate before the patients were clenching or grinding their teeth. So you see how there is a huge connection of, okay, I'm clenching my teeth, my nervous system is getting activated prior to me clenching. Why is that? Well, we're going to see what's happening in a minute. But before we go there, why don't we do that exercise that I was talking about? Let's just get your tea, get your coffee, get your chocolate. Let's just start exploring. Or if you don't have anything, it's okay. You have seen an exercise where they have a lemon and they cut the lemon and you're just looking at it, then you start salivating. Well, it's because your brain thinks that this is happening to you. Or when we're watching a movie, and that happens to me quite a bit. My daughters, they just turn and say, "Are you crying yet?" When we're looking at a movie and then it's a sad story or something, it's not happening to us, but we get emotional because we get a connection with the actors that are in the movie. So it's not real. It's not happening to us, but we start crying. We feel the emotion. So our brain works in that way. So if we are seeing something, or if we're smelling, or if we're hearing something, it can affect us, even if it's not happening to us. So let's do this exercise because the idea is for us to have a little connection with our body. Before we go to the exercise, I want to show you this. And it is my idea of how whole body health should be. We connect the oral health, and then we can find a lot of information in our health, in our oral health, in our mouth, in our body. Then we go to that mental and emotional health. So we know that what we think is going to create a response, just like with the lemon, just like if we're watching a movie, it creates a response in our body. And then also, of course, the physical health, where we have nutrition, where we have toxins, where we have things that affect our physical body. So I called it a biodental health. And it includes that energy body because we're energy beings, and it includes that psychosomatic, that reaction of the body with what we think. And then I include also the transgenerational, because according to epigenetics, all this information that our ancestors, all these events that our ancestors lived or went through is stored in their cells, stores in their DNA, and it transfers to us. So let's just do a little pause and do the exercise. Let's just touch what you have or smell it. See how it smells. What is the reaction? What is happening? And I want you to not only maybe just feel the temperature of the cup or the chocolate. Smell it. I love dark chocolate. Just smell it, smell the grapes, smell the tea, or think about it. Just visualize something, your favorite food, and just pretend you're smelling it, you're feeling the texture, and breathe in. And I want you to start connecting with your body and see what it is that you're feeling. What are those emotions? And if you want, you can close your eyes or lower your eyesight. Sometimes when we do that, we get a little more connected with our body. We get more connected with our emotions. And then you can have a sip or bite of what you have. I want you to feel the texture in your mouth and the temperature in your mouth. Is it causing you to salivate a little more? So we're going to feel that temperature. Now let's just have another sip or a bite. And then I want you to close your eyes and open your mouth. And see if when you're opening your mouth, it intensifies the flavor. And then you can try again, sip one more time or a little bite. And then when you open your mouth, sometimes that flavor gets a little more intense. But then now we're going to go a little bit deeper. And just maybe have another sip of that drink that you're having or a bite of your chocolate. And then with your eyes closed, I want you to just connect with your body and just let your body take you to a place where you had an experience. It could be a pleasant experience. It could be a negative experience. Just connect with that experience. And when you connect with that experience, I want you to just notice the sensations in your body and see where is it that you feel the connection with this experience, with this event that is associated with that sensation in your mouth when you have the drink or the food that you're having. And do you feel relaxed? Do you feel energized? Feel what kind of emotions is that bringing? Is it happiness, maybe a really amazing experience with that same food or drink? Is connecting you with the past, or is connecting you with the present? I just want you to notice your sensations in your body and just notice what emotions are coming to the surface. And I want you to just take your time, breathe through your nose, and when you're ready, you can open your eyes. I would love to hear your experiences. You can write down your emotions or what you felt, the experience. Was it connecting you to a positive or a negative emotion? Was it connecting you with the past, with a recent event or a event from childhood? You see how when we start connecting with our senses, with our emotions, it can take us to the past, to negative emotions. It's just incredible how by paying a little more attention, being a little more aware with our senses, with our emotions, with our body, we can start seeing changes, and it brings things from the past, and it can bring things that we might want to just continue to grow this emotion, right? Or this relationship with the person that we connected with. Or it might mean that we need to do some work and maybe release some of these emotions. I'm going to continue sharing the screen. With this exercise, we are connecting with emotions from the past. But then emotions from the past, if we're thinking about energy, can cause some stagnant energy. If we're talking about our biology, it can cause a response from the body with these different sensations or different emotions. But the thing is that they have done discoveries, and I love this neuroscientist. Her name is Dr. Candace Pert. She wrote a book, The Molecules of Emotion. So there has been studies where they show that emotions are stored in the fascia. The fascia is that lining that surrounds the organs, the tissues. So emotions are stored in the fascia. They have found that there's emotions that are stored in the muscles. So when we're stressed, our muscles contract. When we're clenching our teeth, all the muscles here get all contracted. The neck gets contracted. But she found that there are receptors in every single cell of our body. They're neuropeptides. The neuropeptides are these messengers that go from the brain to the body, that they connect in certain receptors in the cells, in every single cell in our body. There are receptors of emotions. So imagine if we have a conflict, if we have an event, something happened and we're out here, and then we start thinking about it. And depending on our past experiences, depending on our past memories that we have collected throughout life, that's how we're going to respond. Those are the thoughts that we're going to have. What if someone had an experience with eating the chocolate and having an allergic reaction? The thoughts of this person that had an allergic reaction are going to be totally different than these happy thoughts that this other person had with happiness, completely different. And then the feelings are also going to be different. So that's why it's important to start connecting with the emotions, with the sensations in our body. So because we want to go deeper and see, okay, where is this emotion originated? Where do you feel it? What is that sensation? Until we get to the bottom of it. Because a lot of the times when we have a response or when we have a reaction in our body, it can be a reflection of what's happening to us in the past or what we are not able to deal with. All this stagnant energy, if we are thinking about that energetic body. So your body already has the answers to health and well-being. We just need to decode them. We need to find them. We need to go and be more connected with it. So we need to become more aware of what it is that our body is trying to communicate. So for me, this is what can happen sometimes. Like this woman is just looking for, what is the path? So in our case, what is the path to health, well-being, happiness? And we're lost. We have a lot of different tools. We have a map. She has the GPS on her phone, and she's not able to find an answer where to go. And this happens a lot with patients that they have a condition and they go to a naturopath, they go to a regular doctor, they go to have acupuncture, they go and get a massage, they go and have all the essential oils, but they're still having problems. Well, because we're a complex being. Is that one thing fits all? So what works for you is not going to work for someone else. So we need to go in this journey, and I want to invite all of you to go on this journey with me. And in my situation, because this is what I'm passionate about, starts with oral health, because in the mouth, we can find a lot of information, not only about your connection with chronic diseases, but also your connection with these emotions. We saw how the nervous system reacts prior to someone clenching their teeth. We saw how the heart rate of this person that clenches or grinds their teeth reacts before they clench. Why? Why is this happening? Well, because we have experiences in the past. So for me to be able to achieve health and get to longevity, we need to go through this path of exploration. So just start with that oral health. A biodental analysis will be a really helpful. It's like it will shorten your exploration. It's a part of that GPS, part of guiding you towards that route of what it is that I need to work on. What are those emotions and those conflicts that are stored in my subconscious mind? So then we go and project our purpose, what it is that our parents wanted us to do. Then, of course, positive thinking is a big part of it. Rest. And then we go to transgenerational, that information from our ancestors, and do healing. The nutrition is really important. Exercise, and then we can achieve health and longevity. It's a great journey, but it's a journey that needs dedication, needs daily work. Because if we don't do what the doctor is recommending, if we don't follow our heart, if we don't follow the messages that our body is sending us, we won't be able to get to this point of longevity, health, well-being, happiness, and abundance. Abundance of health, abundance of love, material abundance. So I want to invite you to our next session. This is going to be toxins and what to do and how they influence our body, our emotions. Everything around us, so every organ has a field of energy. And then if you think about it, everything around us has a field of energy. And that has been studied and shown with technology. Thank God technology exists, because it has been shown that this is real. When we talk about teeth, even if that tooth was removed, the energy is still there. In many cases, this infected root canal is blocking that meridian. When you remove it, you're not blocking that meridian. There's still energy flowing. So your brain has that neuronal pathway already programmed. And that's why changing habits is so difficult, because you need to change that neuronal pathway. You need to kind of reroute. It's like when the GPS says rerouting. You need to change that, but you have to do it every single day, because your brain has that memory. So to be able to change that neuronal pathway, we need to be doing this every single day or repeatedly to be able to change it, to be able to have the response that we want. So it's incredible what our mind and our body can do for us. I just want to share this information, and the more I learn, the more I know I don't know anything, because I would love to learn more about quantum physics that explains in more detail all this information, or even neuroscience. And I love that neuroscience is now kind of putting things together easier and demonstrating that the psychological, the emotional, that spiritual connection with what's happening to us, it can be explained with science. So I want to thank you all for being here.